Hello, Baltimore. It's Dr. Jeff Kalkstein, your Baltimore chiropractor, and I'm with Bill here. Bill, how long have you been coming to the practice?
Probably 35 years.
35 years, yeah. Yeah, off and on, right?
Off and on, not regularly.
Yeah, yep.
Only when needed.
Only when you get a flat tire.
Right.
He's back, he has a flat tire. So you get a couple flat tires, right? You have one now up in your neck, right?
Right.
And how's your back doing?
Back's doing well now.
Yeah, so that was a little sore when you first came in, right?
Yep.
Yeah, okay. So how did you aggravate your neck?
Not really sure. I think I spent too much time sitting at a computer and too
Yeah.
tensed up, and
Yeah.
it's not an injury, it's just a...
So when were you last well? Or how long has this been bothering you most recently?
This probably started 6 weeks to 2 months ago.
2 months ago. And how about the back? How about that? When did that bother you? More recently?
Well, I've been coming back here now for like 3 weeks, I guess.
Yes.
And it's been good since you adjusted.
Since adjusted, yeah. So to me, people have acute problems, or they have chronic problems. They have acute flare-ups, right?
Right.
Your neck is a chronic problem, or is it just something that...
No, I would say it's chronic, because
Chronic.
I've had it before.
Right.
And same with my lower right back.
Yeah. So let's do this. Go ahead and face Carly a little bit this way so she can see. Let me see you turn your head to the left for you. Okay. All right. Yeah. Any pain anywhere?
No.
No. Now turn towards me, please. Any pain anywhere?
Yeah, it's tight. I can feel it pull.
What side?
Right side.
Right side. Yeah. Now look straight ahead and bring your chin to your chest for me. Any discomfort there anywhere?
I feel a little bit of that knot in the right side.
Like
Yeah,
is it
Mhm.
up in this area, or is it more down in this
No,
area?
it's the first place. It's
Right there, yeah, okay. And now go ahead and look straight ahead. Now let's look at the ceiling. Bend your head backwards for me. Does that bother you at all?
No.
No. Now look over your right shoulder for me this way. Does that bother you at all?
Yeah, I can feel it pull there.
Let's go back the other way. And does that bother you at all?
No.
No. So one of the things we always do, and this is a sort of the dog and pony show, so we're always trying to figure out what's generating the pain. And the options could be, for musculoskeletal, it could be a muscle, it could be a hinge that allows movement to occur, or it could be a disc. And so this dog and pony show is to kind of rule that out. And obviously he's been here a few more times. And so I think Bill primarily has irritated his facet joints. Those are the hinges that allow motion to occur. And as a result of that, the muscles are compensating for that a little bit. So we were adjusting only, and we were doing some soft tissue. We tried a couple sessions of dry needling, and most recently we put on, we did some class 4 25-watt laser on that.
Right.
So what I'm going to do right now is I'm going to adjust them first, and then we'll stand back up, we'll check your range of motion, see if that changed at all, and then we'll go do the laser. Is that all right?
Okay.
We'll do adjust, soft tissue, and then laser. I'm saving the laser for last, because sometimes when I do the soft tissue, it's sore, right?
Mm-hmm.
And how's it feel the next day, though?
It gets looser.
A little bit, yeah. So I'm gonna disrupt the tissue, and then I'm gonna calm it down with the laser. That's what I'm gonna do. Okay. So and with Bill, I sort of adjusted him sitting in the chair. So Carly, I'll let you come around to the head of the table, and Bill, you can safely sit down here for me, please. Yeah. So we're just gonna drop your head here and wait till just like this. And drop your right shoulder. Go ahead, stand up for me now. Now, if you could just, no, face Carly. I'll face her, I want to see something. Go ahead and turn your head to the left again now. Yeah, now go back to the right. Yeah, how's that feel?
A little bit. A little
bit.
looser. Yeah,
You feel like it goes a little further?
Yeah.
Carly, what do you think? Did it went a little further that way? I mean, you guys have a better angle than I do right now. Okay, so now lying on your back for me. There's just a couple different ways to skin a cat, and I just think when I adjust Bill and people that have this condition, if I adjust them sitting in that chair, I get a more fruitful response. So now we're going to go into this direction. Again, the key for this is just let your head sit there. Beautiful. By the way, did either one of those movements cause any discomfort at all?
No, it don't hurt.
Yeah. It looks like it might hurt, right? But you're good, right?
I mean, you sort of hear the noise, but it doesn't hurt.
Yeah, so sometimes when they're in a lot of pain, what I'll do is this. We don't have it in this treatment table doesn't have it, but maybe we'll show them on the way out to to the next spot. So go ahead and step off for me now, and I'll let you go face down, because I do want to adjust your mid back too. I think that's important. When we have neck issues, if we can get in there and get some of that thoracic spine to move, it also produces fruitful results too. So take a nice deep breath in and let it out. Beautiful. Deep breath in. One more time. Let it go, Bill. Let it go. That way. That's awesome. Now go ahead and step off. And I want to see the results this time too. So step over here for me. Turn your head left. Yeah, that's much better. Now go back to the other side. This way. There we go. So I block him there. I don't want him to cheat. I don't want to turn his thoracic spine when he's turning his neck. So if you loosen up this for me and have a seat like right here, we'll start to do some of that soft tissue work. Right? I'll let you slide through there. So we use a product called Huns Honey, and this is a shout out to where my sister-in-law Sarah Batley works. It's a great foundation, and it's a tremendous product. It's like a lip balm. It's a little bit more expensive than what we were using, and I'm not talking about a lot more, but the quality of the product is so superior to what we had before. So again, that's Huns Honey, and so what I've done is I prepped Bill, and I put a layer of that on that upper trapezius, some of his right side paraspinal muscle, and his levator scapula, and I would tell you though, Bill, this is probably the 6th time we've worked on you, something like that maybe?
Mm-hmm.
Yeah. That trigger point or that knot is not as prominent as it was before.
No, I can feel that, but
Yeah.
it's still that track you just went on is really the one
They
I
get
feel
you.
it.
Yeah.
It's not painful, it's just you can feel the stretch, which
Yeah, and I think a lot of people get like this because of their daily activities, whether it's with a computer or a phone.
driving.
Exactly, driving, and yeah. So then we're going to put a little motion to it. We're going to shorten the muscles on that side. We're going to trap that muscle under our fingers, and we're going to make that muscle get a little longer, and then pass it that trigger point or that knot under our fingertips or under our pressure. Tell me if that's too much, please.
Fine.
Yeah, so I'm just doing his upper trap right now, and I come right up to his cervical spine, shorten the muscle, then elongate it. So some people call this a pin and stretch, and some people call it ART or active release technique. And again, it fits into the model of what happens to people musculoskeletally. Now I'm going to come back and get his levator scapula. So Bill, look up at the ceiling for me, turn your head to the right, and then again, we're going to take our chin and we're going to take it to our left knee. So go ahead and you do the motion for me all the way down, right? So we talk about this, whether it's disc, joint, or muscle. In his case, we got joint dysfunction. It doesn't move very well. That joint becomes irritated, inflamed. There's a sensory nerve that goes right to the hinge of the facet joint that communicates to the brain, says, hey, I don't like this. The brain says, ouch. And then it sends compensatory signals down to the muscles around that area. So now the muscles start to go into maybe a protective mode, right? And if you can get the joint to move better, reduce the inflammation, and get those muscles to relax, you're going to help a lot of people. This feels 50% improved, just the muscle tone I'm talking about, not his overall condition, just how the muscle feels to me. Okay, without me helping you, you do it. Go ahead all the way down. Chin. There you go. Beautiful. Okay, so that's good. Now go ahead and stand up for me. And I always like to see this. I want to find out what's working, what's not working. You focus on Bill. Go ahead now, turn your head to the left for me, Bill. Oh yeah, that's really good for you. Now go back the other side. Okay, so that's much better too, yeah. Okay, that's how's
Yeah,
that feel?
when I get as far as I can go, I don't feel the pull right now.
The pull, yeah. How did it feel when I adjusted your mid-back? How's that feel?
That I like, that feels.
Yeah, that really takes a lot of tension. Okay. You know, because everything, your head's falling forward, as the farmers would say, all the leaders or the muscles in the back of your neck are working, they're attaching down there. It creates, it creates so much lack of mobility, which really creates problems. And Bill's a golfer. If I can get his mid-back to move, he's going to hit the ball 10 yards further, right?
I hope 20 maybe.
Okay, so we'll pause right now. Then let's go over and let's do the laser. Do you mind if we show people how that works? Yeah, that's good. Let's go.
And we're back. And we're back. Back at it again with another video. Bill, is it your left or right side that's bothering you?
Right.
Right side? We're doing laser on his cervical brachial area of his neck. So we'll be focusing on this part and a little bit into the traps and a little bit down. With laser, you can either have a perfect protocol, so you can make your own depending on how big the treatment size area is and all that stuff, or you can have a set up protocol. So he's doing neck, and then you have all these other options, but I don't really like any of them. Operations he did in the past were. And then we wear our lovely glasses to keep our eyes protected so we don't burn our retinas. If you wanted to know why I voluntarily put these on. So the last time we did it, we did the settings of 250, 18, 18. So we'll go into the perfect protocol and to put 250, 18, 18 in it. Hit enter, and so it'll be about a 4-minute laser. We'll hit standby. It'll beep a couple times. Basically, it's just a glass ball, just rolls over the area, and as soon as I hit the button, it'll start. It'll just get warm. It might be a little cold to start just because the ball is not been used in a while. The laser emits light, uses light therapy, so it gets a little warm on the patient. So we always ask them to make sure it doesn't get too warm, or if the pressure's okay or anything like that. Benefits of laser: it helps with the muscles recover. It brings blood to the cells, helps bring in nutrients, all that stuff that the muscles need to recover to build better, faster, cleaner. But is this all the areas that's bothering you, like up in here and down a little bit, Bill?
And he's done after these 2.5 minutes.
Yep, he's probably good to go unless he has any other modalities written on his treatment plan from the docs. Pretty much it. I think you're done after this, right? Unless you have like exercises or something. Okay. The only thing with laser, like, if someone has a tattoo in the area that's bothering them, like, you might not be able to do it just because if you roll over it, it could burn them with the tattoo. So that's just one thing that we're kind of precautious about. Usually, like, scars and all that other stuff, like, we can go over. Yeah. It's not too warm, is it?
No.
Okay.